So, Swoop, that was a good assessment that we had there. How are you feeling?
Pretty good.
That's good. I would like to share some of the findings that I found during the assessment with you, if that's okay.
Sure.
Okay, so the first thing that I would like to discuss is the probing depths that we found. So, as you know from our discussion before, that anything above a 3 is something that we would like to fix or look at. So, in your 6 front teeth here on the top, we found that you had levels above about a 4. So with the combination of these, we were able to find what we call the clinical attachment level. That's the amount of attachment that your teeth has into the bone. So with the clinical attachment level, your probing depths, we also found a little bit of bleeding while we were doing the probing. So with these 3 things and the recession that you have, we were able to find that you have what we call chronic localized early periodontitis. Do you know what periodontitis is?
I've heard of it before, but I don't know what it is.
Okay, well, periodontitis is a bacterial infection of the gums, the bone, and the surrounding structures. So this is caused by plaque, which is the sticky, colorless film that is constantly forming over your teeth, and calculus, which is a hardened form of plaque. So these are the cause of periodontitis. So the reason that we call it chronic is that it's been there for a while. It's localized because it's just in these 6 front teeth here. It's early because it hasn't advanced. It's still in a very beginning stage of it. And this is associated with your diabetes. I know that's a lot to take in. How are you understanding that so far? Does it make sense to you?
Yeah.
So what do you think periodontitis is?
It's an infection caused by bacteria in my mouth, and it affects my gums and the bone that support my teeth.
Exactly. So the second thing that we found is in the rest of your teeth. So this is chronic generalized moderate periodontitis. It's very similar. It's also caused by the plaque and calculus, and it is associated with your diabetes. But this time it's moderate, meaning the clinical attachment level is a bit less, and it can cause some of the mobility that you're experiencing in your top right molar, this one right here. So the reason that it is chronic is, once again, that it is, and it has been there for a while, and with the moderate, it's a more advanced level with your attachment levels. Is this making sense to you so far?
Yeah, so it's worse on those teeth than it is on my front teeth.
Exactly. So I've come up with an appointment plan and some goals that I would like to share with you to stop the progression of the periodontitis. Is it okay if I share these with you?
Yeah.
So periodontitis can't be reversed. So the damage that's already done, we can't get rid of that, but we can stop the progression. So the first thing that I would like to teach you is how to do a modified fast brushing method. Right now, how often are you brushing your teeth?
Twice a day.
Twice a day, that's good. So the difference is that I would like to teach you this brushing method that will help to stop the recession and further taking away your gum line. So we're going to do this at first, and the risk of this is that if you do it too hard, you're going to continue to recede your gums. But the benefits are that it's going to take away the plaque from on your teeth, and also with this method you can take it away from under your gums. So we're going to start with that, and then in our second appointment I would like to teach you how to floss, which is going to remove the bacteria and plaque from in between your teeth, stopping further progression of the periodontitis. And also in that appointment, we'll assess your brushing methods to see how they're going for you, and if they're not working or they're too hard, we can find something that's a bit similar, but also simple enough that you can accomplish this. In our third appointment, we'll assess your flossing and see how that's going for you, and also teach you how to use a tongue cleaner. By using a tongue cleaner, it will help to reduce the amount of bacteria on your tongue and stop the spread of bacteria throughout your mouth and prevent any halitosis. The risk of this is that it can cause some cuts on your tongue if you press too hard, but it will help to stop the bacteria, and we'll teach you how to do it properly so that we're not going to have any So, once again, those 3 things that I'm going to teach you to do throughout the next 3 appointments are to brush your teeth using the modified BAS method, to floss your teeth using the C-shaped method, and to use a tongue cleaner. Do those 3 things sound good to you?
Yeah.
All
I
right,
think I can manage it.
that's good. So the first thing that I'm going to teach you how to do during this is to teach you how to use the modified BAS brushing method. So we want to do this twice a day, every day, and then we'll be able to assess this and see how your probing levels are going and to see if it's stopping the progression of the periodontitis.
Okay.
So after we teach you how to use the modified brushing method, we'll debride your teeth. So this is where we scale your teeth with hand instruments to remove the calculus. The risk of this is that it may cause a little bit of pain or sensitivity for a day or so, but by doing this we'll help to reduce the amount of bacteria in your mouth and help make a cleaner environment for you to be able to maintain while you're doing your self-care at home. And it will also help to reduce the amounts of probing dust and calculus that are in your mouth. So is this okay with you? Are you okay with the goals that we have set out and the appointment plan for today?
Yeah.
Okay, sounds good. We'll get started then. So after we teach you how to do the modified brushing method, I would like to debride your teeth. So this is the scaling of your teeth with hand instruments so that we can remove the calculus from around your gum line and under your teeth. This will help to reduce the amount of bacteria that's in your mouth that are building up around the calculus. And the risk of this would be that it may cause a little bit of discomfort or sensitivity for a day or so, but it will also help to stop the progression of the periodontitis by removing the calculus. Does this make sense to you so far?
Yeah.
Okay, perfect. So if it's okay with you, I would like to get started on the appointment plan and the scheduled appointments that we had so far. But before that, I would like to let you know that you have the right to refuse any of these appointments. And if you do refuse them, we can come up with a plan that's better for you and works more within your schedule. Does this all sound good to you?
Yeah.
Okay, perfect. How about we get started now?
Okay.
So Betty, from your assessment, I found that your probing depths have reduced, but you still do have periodontitis. Do you remember what periodontitis is from our last appointment?
Isn't it the infection of my gums and the supporting bone, and it's from the bacteria in my mouth?
Exactly, it's a bacterial infection of your gums, the bones, and the surrounding structures. And do you remember what it was caused by?
The bacteria and the diabetes that I have.
Yep, and plaque and calculus. So, last appointment we had taught you how to brush with a modified BAS brushing method. How often are you doing this?
I do it twice a day, in the
And-
morning and night.
Okay, and do you find this comfortable for you? Are you
Yeah.
having any problems with it?
No.
No, not at all. So I would like to get you to demonstrate this just to make sure that we're still brushing properly. So you brought your toothbrush with you, and I'll give you this mirror. That's great, you're doing a great job. Perfect. So, after last appointment, we discussed what our second step would be, and that would be to floss your teeth with a C-shaped flossing method. So this will help to remove the plaque and bacteria from in between your teeth and help to prevent any further progression of the periodontitis from in between your contact areas. So the risk of this is that it can cause some floss cuts, which is just cuts from the floss. But we can prevent this from using a seesaw method up into the contact area and then wrapping it around, and I'll show you how to do that properly. I would like to let you know that you do have the right to refuse this treatment. We can find something that works better for you if it's not working for you. Does this all make sense to you?
Yeah, that sounds good.
So is it okay if I go ahead and start teaching you how to use the C-shaped method of flossing?
Yeah.
Okay, perfect. So Betty, from your assessment, we found that your probing depths have reduced, but you still do have periodontitis. Do you remember what periodontitis is?
It's the infection in my mouth caused by plaque and calculus, and it's affecting my gums and the bone that support my teeth.
Exactly. So, although we can stop the progression of periodontitis, we can't reduce the damage that has been already done. But through your brushing that you've been doing and your flossing, you have been able to stop the progression of this. So, I'm very proud of you for making these steps and changes to your oral health. So, last time we did discuss the flossing with the C-shaped method. How is this going for you? Are you having any troubles with this at all?
No, it's good.
That's good. And how often are you flossing your teeth?
I floss once a day at night.
Okay, perfect. So at the end of this, I'm going to get you to demonstrate this for us. And I will also like to teach you how to use a tongue cleaner during this appointment. So this will help to remove the white coating of your tongue and help to take away any bacteria that is in that. So this will also help to reduce the amount of bacteria that's being transferred throughout your mouth and prevent any halitosis or bad breath that may come in the future from having this white coating of bacteria over your teeth and tongue.
Okay.
So I would like to teach you this if it's okay with you, but I'll tell you the risks and benefits of it first. So the risks of this are that it may cause some cuts on your tongue, but they will heal in a couple days. But this can be caused from pressing too hard while using the tongue cleaner. But the benefits of this is that it will take away the bacteria that's on your tongue and reduce the transfer of this bacteria throughout your mouth. By doing this, removing the bacteria, it will also help to prevent any bad breath. So you do have the right to refuse this treatment if you can't find that it works for you or you're having trouble with it, and we can find something a bit simpler and similar that will work for you. So if it's okay with you, I would like to teach you how to use the tongue cleaner and assess your flossing methods.
Yeah, that sounds good.
Okay, perfect. Let's get started.
Okay.